entrepreneur and business executive. She has been one of the few pioneers of telemedicine in South Africa and Africa, with representation at various levels of government and non-governmental organizations. Born in Soweto, she grew up in Lesotho, where she completed her early education. She achieved a BSc degree at Roma University in Lesotho and went on to study for an MBCHB at the Medical University of South Africa, where she qualified as a medical doctor. She practiced as a community doctor for a number of years, as well as working for major pharmaceutical companies before entering into the field of business. Dr. Molefi currently holds executive positions at Telemedicine Africa Pty and Sanpa Africa Pty. The telemedicine unit was established as a joint project of the Department of Health and the MRC and has gone a long way in delivering a solution to the severe problem of inadequate services and geographical challenges which confound the South African health system, a result of long-standing, previously misplaced priorities. Dr. Molefi continues to consult to the Medical Research Council on the implementation of a virtual hospital network involving 18 hospitals in one of the provinces in South Africa. Some of the awards she obtained during her career are Technology for Women in Business Award, supported by the DTI in 2011, Medium-Sized Company Winner and Overall Winner. She also won Tatrick Scholarship for Telemedicine from the US Army. Dr. Molefi's success has been built on a solid work ethic, a belief in the power of technology, and an unwavering insistence that business must first do good to do well.
Quite interesting, Dr. Lynette Molefi. Thank you very much for joining us this morning. They put the whole engine number of you there, but which is very, very interesting. Now, when you joined the profession or made a decision to study medicine, telemedicine was not there. So why did you join medicine and why did you change along the way?
Funny enough, for me to join medicine, I did a BSc degree and I worked for pharmaceuticals companies in a lab. And I was really bored. I knew that I needed to go and work with people. I guess I've always been an entrepreneur because I remember when I got to Medunsa and Prof. Mokhotlane asked us, why did you join medicine? Some people said to help patients, and I said, I want to make money. I see the doctors making money. So I've always wanted to be an entrepreneur. And once I finished medicine, I then decided, I did a lot of research, and telemedicine was one of those things that I know is now a third pillar of the healthcare industry, and I decided to venture into that.
How was South Africa done insofar as telemedicine is concerned? I would suspect that when you first started off in this, it was fairly novel. A lot of people did not know about it, but of course the need was always there. And since that time up to now, in a general sense, how has South Africa fared in this area? I think
we've actually, we were the leaders on the continent, but we are stalling in terms of our implementation. I think as South Africans, we start innovations, but they end up being implemented in other countries. And I'll give you a few examples of some of the research that was done in South Africa, but the implementation is in Rwanda or wherever. So I do think as South Africans, we need to look at innovation and start making sure that we utilize all the innovation that we create in the country.
Dr. Mpunja, one of the reasons why we have this show is really to encourage and to further motivate all those youngsters who have just passed matric and who have chosen the noble profession as something that they want to follow. And you are here, you guys, to say to them, it's not all about clinical. There are many other things that can be done. What is your experience? How has medicine evolved over the years? I mean, you have me here as a television talk show host. I mean, this is something totally different. Do you find that with the passage of time, with technology coming up, that medicine is geared towards, expanding and having many options that young people might find more exciting, maybe?
Yes, there has been a lot of development. It's not only when you study to be a doctor, to think about treating a patient.